A provocative column we saw in the Wall Street Journal. It is about the drugs called statins. In fact, one of them, Lipitor, may be the most widely prescribed drug in the nation. But some people are claiming an unpublicized side effect from the medication: memory loss, difficulty concentrating, fuzzy thoughts. Today, 69-year-old Jane Brunsey loves volunteering for her granddaughter's middle school. But not long ago, her memory was so bad, while babysitting, she even lost track of her granddaughter.
I didn't want to talk on the phone because I couldn't think of what to say. I didn't know the words to answer people that asked me questions. I began to see the people I was talking to looking at each other kind of funny.
Her daughter Kristen was so concerned she explored getting Alzheimer's care for her mother and refused to let her babysit for her own grandchild.
It was devastating because she's just as important to Rachel as I am.
But Jane says it wasn't old age causing the memory problem. It was her cholesterol-lowering drug, or statin.
When I decided to stop taking Lipitor, within about 8 days, I would say, I was back to normal. I literally had to change doctors in order to do that.
Statins are used by millions of Americans in the hope of reducing the risk of a heart attack. And while they've saved thousands of lives, they have well-known side effects like muscle cramping. But is there a less publicized side effect? Memory loss. Dr. Beatrice Gullum runs the Statin Effect Study, where for the past 6 years, patients on statins have been able to report their own side effects to her website.
Of the first 1,000 or so reports that came to our office, 48% of them reported memory problems.
These side effects, can they mimic serious diseases like Alzheimer's?
They don't remember where they went earlier that day, what they had for breakfast.
Pfizer, the maker of Lipitor, tells ABC in a statement that the clinical trial data, quote, does not establish a causal link between Lipitor and memory loss.
10.
But for Jane Brunsey, who now controls her cholesterol through diet, the link was clear.
Good. I don't want to be the person in a nursing home with the lowest cholesterol. You know, I would rather have a high cholesterol and have a life.
And now on call, Dr. Timothy Johnson, who is ABC News medical editor. Tim, what about this? Thousands of people reporting anecdotally everywhere that they have word and memory loss on Lipitor. What does this say to you?
Well, I think we have to take these complaints seriously. I want to put it in perspective by pointing out that the company that makes Lipitor, one of the statins, has about 145 million years of patient experience in over 400 studies. They say that about 2% of people will report some kind of memory loss. The study that you quoted in the piece, that's a self-selected sample. In other words, these are only people who think they have a problem and therefore report it in. So that doesn't really tell us much except for those people's experience. But I think when a patient complains of this, we ought to absolutely take it seriously. And if they really need a statin, if they can benefit from a statin, we ought to lower the dose or switch to another statin, which in many cases will take care of the problem.
But 2% could still be a lot of people, right?
It could be a lot of people. We have no idea what the status of those people is. These are just reports that come in over the transom, so to speak. But again, my attitude is if a patient is complaining about it, you take it seriously, you go over it with them, you see if there are other reasons causing it. If they really need the statin, if they've already had a heart attack or a stroke, or they are at high risk for heart attacks and strokes and can really benefit from the drug, try another statin. I know personally some people who have done that, and it's worked just fine for them. Worst case scenario, you stop the statin and use other means to lower cholesterol.
Well,
For most of us, cholesterol is a bad word. Everyone from doctors and scientists to regulatory agencies and drug companies, and especially the media, blames cholesterol for everything bad that happens to us health-wise. Even the U.S. Department of Health and Human Services has spent many millions of dollars to keep Americans informed about the dangers of cholesterol, especially when it comes to heart disease. Normally, this wouldn't be an issue. After all, they are looking out for your health, right? Not necessarily. The real truth is that your cholesterol levels have nothing to do with your risk of heart disease. But still, healthcare practitioners go on pumping you full of dangerous, nutrient-depleting medication when a truly effective solution sits right on your shelf and costs just pennies a day. The exciting natural alternative. New research shows a common household vitamin may be more powerful than statins in managing your lipid profile and heart disease risk. Niacin, also known as vitamin B3, is one of the more important B vitamins around. It helps your body use fats and protein and converts carbohydrates into fuel for energy production. It also keeps your brain, nervous system, and over 50 of your body's much-needed enzymes working properly. But niacin's real power lies in its cardiovascular benefits. Specifically, it has been shown to improve not just one, but multiple lipid parameters that predict risk for heart disease. It was also shown to significantly slow plaque formation when added to statin therapy in patients with known coronary disease and atherosclerosis. So why do doctors still continue to push statins for heart health and insist on telling us that cholesterol is the devil? To understand why, we first need to unravel the myth of cholesterol. Once upon a time, back in 1936, cholesterol and plaque formation were believed to be associated with the development of heart disease. However, two preeminent physicians, Drs. Landay and Sperry, could find no connection between the two. Neither did others. What's more, lowering cholesterol with drugs didn't make the slightest difference to plaque formation. Fast forward to 2002 and the Framingham Heart Study, which looked at risk factors for heart disease in over 5,000 men and women over their lifetimes. They discovered that 80% of people who go on to have coronary artery disease have the same total blood cholesterol values as those who didn't go on to have heart problems. In other words, total blood cholesterol levels have absolutely nothing to do with the likelihood of developing heart disease. Yet, today, the U.S. National Institutes of Health still claims your cholesterol level has a lot to do with your chances of getting heart disease. What gives? Statins and the cholesterol-lowering scam. In a word, it comes down to money, and statins are big money, worth billions in sales to drug companies. Statins block a liver enzyme needed to make cholesterol. Your body reacts by taking the cholesterol it needs from your diet, lowering your blood cholesterol levels. Well, what's the point of having a drug if you don't have a disease? Enter the cholesterol-lowering scam. Even though there's no connection between cholesterol and heart disease, scare tactics by the drug companies, which are propagated first by the medical profession and then the media, have convinced us all that cholesterol is evil, while statins are the knights on white horses come to rescue us. This propaganda has been so effective that statins are prescribed daily as the first choice of treatment for people with heart problems. This is terrifying when you consider the dangerous nature of these medications. According to an overview of 7 randomized controlled trials with over 50,000 participants, statins cause significantly higher liver enzyme abnormalities, which, left unchecked, can lead to permanent liver damage. They also cause muscle pain and tenderness and may trigger an inflammatory autoimmune breakdown of muscle cells in combination with other drugs causing kidney damage. Last but not least, statins are known to deplete levels of COQ10, a potent antioxidant that's also intimately involved in energy production. You see, your heart is the hardest working muscle in your body and needs a lot of energy to do its job. By preventing the heart from making COQ10, statins block energy production and compromise heart function. In other words, they actually end up harming the hearts of patients being treated for heart disease. In spite of this, statins are now being recommended as a preventative medication for individuals without any prior history of heart disease, even though experts could not find any benefits of statin therapy in such instances in over 11 clinical trials with over 65,000 participants. As bad as all of this is, what's the most damning is that a natural solution to heart health, including balancing healthy levels of cholesterol in the body, lies in niacin. Niacin and heart disease risk. The presence of small, dense type of LDL has been shown to raise the risk of heart disease by up to 3-fold. Similarly, high levels of triglycerides also raise risk. In randomized, double-blind, placebo-controlled studies, over 300 patients with genetically high levels of LDL and triglycerides were treated with 2 grams of niacin every day. Alternatively, the same dose of niacin was given to patients with metabolic syndrome and type 2 diabetes, who also have similarly high levels of these lipids. In both instances, niacin lowered harmful small, dense LDL and triglycerides, significantly reducing the risk of heart disease. And that's not all. Out with the bad and in with the good. Low levels of high-density lipoprotein, HDL, are now also known to be an independent risk factor for heart disease. Some experts even believe that the ratio of total cholesterol to HDL is a better indicator of risk than either total cholesterol or LDL levels. In the same randomized double-blind studies described above, 2 grams of daily niacin also significantly raised HDL levels in patients at high risk for heart disease. By doing so, it provides an extra level of heart protection that statins just can't match. In large part because statins have no effect on HDL levels. In fact, studies show that niacin raises levels of HDL better than any other anti-lipid treatment. But wait, there's more. As we saw before, plaque formation is a necessary first step in development of heart disease. In a double-blind controlled study, 2 grams daily of niacin were added to statin therapy in patients with type 2 diabetes with coronary heart disease or atherosclerosis. Not only did niacin raise HDL and reduce LDL as expected, it also significantly reduced plaque formation within 12 months. This means niacin actually reverses the progress of plaque formation, which had never been reported before. How does niacin do this? One possibility might be via its effects on apolipoprotein B, or ApoB, a critical protein that's absolutely necessary for LDL formation, though researchers don't yet know exactly why or how high ApoB levels cause plaque formation and lead to heart disease. In randomized double-blind studies, niacin significantly lowered ApoB levels, which might explain how it was able to reduce plaque formation. Again, this is something statins simply can't do. Yet again, another instance in which niacin outperforms statins. In brief, overall, niacin has a beneficial effect on all major blood lipids. It lowers harmful small dense LDL, and its structural component, ApoB, reduces triglycerides and raises HDL levels. All of these changes work together to lower heart disease risk.
This nicotinic acid is an important neuroprotective agent that combats stress and the effects of aging. Niacin breaks down into nicotinamide. Low niacin levels are associated to poor concentration, anxiety, restlessness, apathy, fatigue, and chronic alcoholism. A California study suggested that it helps restore cognitive function in cases of Alzheimer's disease. It is also used for treating ADHD and is also referred to as vitamin B3 or vitamin PP. Niacin also helps repair DNA and the production of hormones by the adrenal gland. Niacin helps with high cholesterol and circulation issues. Niacinamide is also used in combination with vitamin C for cancer therapy. Recommended daily. Niacinamide is generally well tolerated in usual doses, 14 milligrams daily for women, 16 milligrams daily for men. The upper healthy limit is 35 milligrams daily for adults. Side effects are diarrhea, dizziness, headache, itching, nausea, stomach upset, temporary feeling of warmth or flushing of the skin at very high dosages. Conflicts. WebMD reports major interactions with Arava, also referred to as leflunomide.
There is a vitamin niacin, right, that has some cholesterol-lowering properties, but is it as good as a statin if you need to switch off statins altogether?
It isn't as good, but it does work, and the problem with it, it usually causes side effects such as facial flushing. There are some new versions of niacin coming out that appear to be better in terms of that side effect.